welcome you to our first ever virtual community forum. My name is Maggie Hudson. I'm the Chief Financial and Operations Officer of Santiam Hospital. Tonight, our goal is really to provide a platform to either provide some education as to what we are doing on behalf of Santiam Hospital and our clinics, what's happening in our local market, some basic information, and to provide a platform for you to ask questions, and we will try to respond accordingly. Please just post away. We will get your questions and we will address them towards the end. All right, with me tonight, we have our two co-chairs, our task force members. First is Dr. Janine Van Sant. She is an infectious disease physician with Santiam Hospital. She's the medical director of our infectious disease program. She became interested in infectious disease after serving in the Peace Corps in Cameroon. She actually had malaria a few times and discovered she has an interest in infectious disease. She has worked abroad in Africa, Central and South America, addressing different diseases such as TB, HIV, malaria, and other diseases. Also with us is Dr. Steve Betts. He's an emergency room physician. He's the medical director of the Santiam Hospital Emergency Department as well as our EMS. He's also the medical director of many local EMS services in our market. He's affiliated with the VA. And a little fun fact about Dr. Betts is that he used to be an RN with Santiam Hospital back in the 90s, went back to medical school, and has returned back to Santiam to work with us, and we appreciate having him here. He is a bit of an expert as he was deployed to Omaha, Nebraska in January to actually go and take care of the patients that, the Americans who came back from the epicenter and were quarantined. And it's through, what's the name of the program? It's through the
NDMS, which is part of Health and Human Services.
Yeah. So these are your two experts, and I will say they are going to be the ones really providing the information tonight, but I also will leave you with the key takeaway I think that I can provide, and that is that we are here for you, and we will know you by your name. So Santiam Hospital is a 40-bed acute care hospital. In 2013, we opened a new replacement hospital. That hospital was built with state-of-the-art technology. We have new inpatient rooms and a fully equipped ICU. We have trained physicians, just like these two right by me here. We have nurses, paramedics, medical technologists, all of the staff that would support all of your needs. We believe that we are a good entry point into the medical system. We may not be able to, take care of all of your needs, but this is a good place to start. Before we get started, there are a few shout outs I would like to make. One is that we want to thank Calcano Media, our local media company, for helping us set this up. We really appreciate the efforts. We probably wouldn't have been able to do it without him. And then also, we've had some really big community outpouring, and we want to thank all of you. We have had the donations in the forms of masks being made. So to all of those sewers, we thank you. Keep them coming. We're using them in different capacities. We appreciate them. A few that I'd like to shout out to are To The Point Quilting, St. James Sew and Sew What Group, Madison Hall, Staten Sports, and there's so many other out there. We have kits that are coming, and so if you're interested in sewing, we still have more kits that we'll be bringing out to you. Also, shout out to those businesses who are donating masks and other gear for us, such as Hyacinth Collision, Knights of Columbus, Red Bull, Staten Castle, Emery & Sons, Stop and Save, 7-Eleven, Wilco, and so many more businesses. Your generosity for all of you has just been so helpful. We really appreciate it. If you are interested in donating, we have an email where you can make those requests at giving@santiamhospital.org. I also want to let you know of one service that we are offering that could be very useful to those who are vulnerable and in need but can't leave their homes. Our service integration team has gone mobile, and so thank you to Melissa Bauer and Robert Julio. They've put together the SIT mobilization program, so they are out there delivering basic needs like food and prescriptions, working with the local police departments, and we have SIT mobile drivers that are out there delivering these services. We want to thank United Way and MAPS Credit Union for helping fund part of this project, and so for those out there, if you have a need, you can email sitmobile@santiamhospital.org. So those are just a couple of the things where we've seen the community come together. And so now we'll move more into the COVID-19 response and the preparation by Santiam Hospital. So I would invite Dr. Betts at this time to give an update to where we are.
Sure. Thank you, Maggie. So I just wanted to start off with just a brief situation report of where we're at in Oregon and in the local area. So in Oregon, there's been 606 cases of COVID-19 confirmed so far. There's been 16 deaths. In Marion County, there's been 123 confirmed cases. In Lynn County, there's been 36 confirmed cases. There's been 4 deaths between the 2 counties. At Santiam Hospital, we've had 10 positive tests. One of those was an inpatient. We have several inpatients that are still pending results. We've had several that were outpatient, people tested in the emergency department and then discharged, or through the clinic, through our affiliated clinics. So there is increasing activity in our community, and I think that speaks to the importance of continued vigilance for our communities. I just wanted to mention the importance of social distancing. I know that everybody is making sacrifices at this point in the effort of social distancing, and that is critical for all of us. I think ultimately, at the end of the day, social distancing will make a larger impact on this pandemic than will all the efforts of medical providers. The phrase of bending the curve is spoken often, but its importance can't be overstated. The goal is to prevent the peak of activity from exceeding our medical capacities, and that's really the point of all this social distancing and self-quarantining. The University of Washington has put out mathematical modeling to try to determine when the peak of activity may be. And just in the last few days, that modeling has changed in the sense that the peak was predicted to happen at April 24th and now is predicted for May 3rd. Although that sounds disheartening in the sense that it will take so long, it's actually a fantastic thing because that means that we are unlikely to exceed our medical capacity if that modeling turns out to be true. I just wanted to thank everybody for the sacrifices they're making. My family is held up in our house as well, and I certainly understand what people are going through. At this point, I'd like to turn it over to Dr. Van Sant to talk about some of our outpatient responses.
So Santiam is developing many different programs to address COVID-19, and the first that I am involved in is
Different types of testing and what testing is available at this point.
Sure. So we do still have limited testing, and right now we are only testing people who are symptomatic. This has implications for people's jobs, so we're not doing widespread screening for jobs yet. We just don't have enough tests. But we are screening anybody who has symptoms that are consistent with COVID. So that's fever, cough, or shortness of breath. And those tests are available in respiratory clinic and the ER and the inpatient side. And we are working with our lab to find different means of testing. So it is still somewhat limited, but and it's only symptoms based at this time. But we are developing different means of testing, and it should be more widely available in the next couple weeks.
Thank you. I just wanted to talk about some of the hospital's response. The first major response was to halt elective surgeries and many elective activities, although some low-risk things do continue at the fringes. But major surgeries that are elective have been postponed, and we're not sure when we will be able to return to elective activities. We have increased our capacity as far as ICU capacity. We've set up backup teams of physicians and providers. We've done a lot of additional training for PPE and infection control.
PPE stands for personal protective equipment, sorry.
Yep, personal protective equipment, thank you. Some of our limitations on laboratory testing are based on laboratory media and supplies. We expect that those supplies will improve in short order, hopefully in a week or two, and we should have increasing testing capacity. Initially, the testing was limited to just the state lab, and then has increased to private labs like LabCorp, which is what we're currently using for most of our activity. But hopefully in a week or two, we will start performing in-house testing, which would decrease our turnaround time to just a few hours. There will also be, at some point, the ability to test for antibodies, which would help us to tell if somebody has had the infection in the past, which would have a lot of utility for us. I think that sums up the data that we wanted to project to, and we wanted to move on to question and answers. I wanted to thank the people that are behind me. These are some of our staff that are helping us, and they can help us with shout-out questions if we need to. I don't think any physician at the beginning of a respiratory pandemic would disagree by saying if you have never considered stopping smoking, this is probably a good time. Vaping as well. So if anybody has questions that they want to ask Dr. Van Sant or I, or Maggie Hudson, please feel free to start texting them in, and we will answer them to the best of our ability.
So I see one here that I can answer, a hypothetical. If I think I have symptoms, what do I do, and how do I approach the care system? To be clear, we
Question about possible treatments for COVID-19. I think Dr. Van Sant and I are in agreement about this, but I'll let you.
Well,
please.
so the short answer is that there is no evidence-based pharmaceutical treatment for COVID-19. and care for COVID-19 is supportive. By that I mean it's the same as other respiratory, upper respiratory infections, viral upper respiratory infections. So mainly it's rest and pushing fluids and keeping your distance from other people. I mean, you need to be washing your hands frequently, covering your mouth, and staying home when you're sick. But to emphasize, I know there's been a lot of discussion about different agents that might be useful. The data is just not there yet, and so we are only, I mean, it's being studied right now, but the only times people are using those medications that have been mentioned in the media is really if someone is critical in the ICU, and basically it's kind of a last-ditch effort. So there is no pharmaceutical treatment for COVID-19.
And I would say that those medications are not entirely benign as well.
Yeah.
They do have side effects, and it's not entirely clear that the benefit outweigh the benefits. The
Outweighs the
benefits
risk.
outweigh the risk. Thank you.
Yeah.
What about Tylenol? Can we take it? I would say yes, you can take Tylenol. Don't worry about it. You don't exceed the directions on the bottle. Don't take excessive doses, but you can take Tylenol. Are there any immunity tests available at state and community hospital at this time? No, there are not. We hope to have it in the next week or two, but we cannot be sure.
So that is the one of the types of on-site testing that we are working on getting. The one just is a PCR that detects the virus itself, so it tells you in the moment if you have the virus in your throat. And the other one is testing your antibodies. So that should tell us if you have had a remote history of the infection. So we do think that there has been some community spread that we were not able to document because the testing wasn't widely available. But it also shows you if you have new infection. So that's going to be very useful for getting people back to work in the medical community, I think. But we need to be cognizant of the reality that we really are not going to be able to get people back to work right away. The social distancing, as Dr. Betts said, is probably the most important aspect of this to make sure that people are not spreading it at this point.
Salem Hospital just told us that they have no tests available until mid-April. I can't speak to Salem Hospital. I'm not a member of their organization. I can say that testing capabilities are limited everywhere, and every organization has to limit and triage who they can test. It's unfortunate, and we hope to have better testing capabilities very soon. To clarify, calling into telehealth right now means calling your local primary care clinics to be helped via telehealth. Is that true?
It is true. So you can access, we have launched telehealth services in all of our primary care clinics as well as our specialty clinics. So if you can be seen for a rule out for the respiratory issue through the respiratory clinic, or for just a basic visit where you need to engage with your primary care provider. So we encourage you to still keep in contact with your primary care office, and telehealth is available for many other services now too.
Maggie, can you speak to visitor restrictions in the hospital right now?
Sure. So in the hospital, we have restricted visitation to a degree. The hours are from 11 a.m. to 7 p.m. One visitor on average, or one visitor per patient. There are a few exceptions to that rule. Just so you know, we are screening all visitors that come into the facility. So you may be asked a series of questions upon entry, and depending upon your answer to those questions, you may be provided with a mask and your temperature will be taken. We have 2 entrances into the facility. We have actually closed the back north entrance, so you would have to access the hospital either through the main entrance or through the emergency room entrance.
Can you speak to whether there's any changes at the birth center?
In terms of visitor restrictions, we are taking it on a case-by-case basis, and so the policy is 1 visitor per patient. There obviously are reasons at times where you may need some exception to that rule, and so that would be taken on a case-by-case basis.
Thank you.
Mm-hmm.
Dr. Van Sant, are the masks, I'm guessing they're talking about the locally manufactured masks, are they actually effective?
So the masks, essentially the masks are blocking the aerosolization of the droplets when you cough. And so just putting something in front of your mouth when you cough is effective. That could be your hand, your elbow. I mean, putting something to kind of catch the droplets is the goal of that. So surgical masks are effective for that. We would encourage people not to stockpile the masks because there is a national and I'm sure international shortage of masks that can help us to protect the healthcare workers. So really, it is way more effective to stay home. I mean, that the bottom line is that we do need to be social. There is no substitute for social distancing. Wearing a mask in public is really not accomplishing as much as just staying home. And that's what we're asking you to do right now. And I know that it's tough. I mean, it is really asking a lot of people, but it is so much more effective to stay home than it is to wear a mask. And so please help us to do that.
Next question is, I may have already had COVID-19 on January 29th in Las Vegas, Nevada. I'd be interested in knowing what to do next. Well, I would say if you had it in January and you're typing this now, then you clearly have survived. And so the best thing to do now is to go about your normal business, I would suppose. However, I think that it's frankly unlikely that somebody had the virus in Las Vegas, Nevada on the 29th. I think it's theoretically possible, but I would also say it's theoretically possible that there are aliens in my backyard right now. I just don't think it's very likely. There's just not that many people in the United States that had COVID in late January. And if there was somebody who was infected in Las Vegas, you'd probably have clusters of cases, which haven't happened.
But I will say that, so this virus is related to a family of viruses that are essentially the common cold and have been around for a long time. So coronavirus is a type of virus that was around before now. COVID-19 is just something that our bodies haven't seen before, and that's why it's kind of running amok in the human population right now. But once you have had it, likely you will be immune. I mean, that is, now with flu, that is why we get flu shots from year to year, is that it varies a little bit from year to year. But with most viruses, once you've had it, you are immune. So actually, if you have had it in the past, you're kind of lucky at this point because you are probably immune. And I mean, that actually, the fact that you lived through that and are still fine is probably, I mean, very good for you. It means that you kind of got it before the big push of everybody getting it.
How can we how can we safely go to the grocery store? I would say, go to the grocery store like you normally would, in the sense that there's nothing specific that you need to do. I would try to go during off hours. I would try to avoid bunching up into tight groups. I would wash my hands when I leave the grocery store, and but I wouldn't be too fearful.
So social distancing rules apply at the grocery store as well. So try to keep a distance of 6 feet. You will see that people's behaviors have changed. So there is an etiquette about distancing now that you just need to be conscious of it in a way that we didn't have to before. So I mean, things like standing next to each other in the checkout line, it's highly frowned upon and makes people very aggravated at this point. But you want to keep your distance, essentially. The upshot of that is that if you are sick, I think that using either a delivery service for groceries or calling our team at the hospital and asking us to help you with grocery delivery is a really good idea, because you should not be going, if you are sick, try to minimize how much you're going out. And by that I mean, get creative with the solutions. I mean, ask your friends and family that are well to drop off groceries for you if that's a possibility. Also, one thing by definition we can't, things like putting a broadcast up on Facebook, it doesn't get to those people who don't aren't internet savvy. So please help your neighbors who are elderly and may not have access to the internet. I mean, calling people, checking on them, I mean, not in person, but just making sure that your neighbors are okay is a very good idea at this time. And taking care of your community is a good idea. If you have a shut-in neighbor, elderly neighbor who is not savvy with the internet, maybe just give them a call and see if you can help.
The next question is, once you've had it, can you get it again? So I would say that probably not. It's unclear. We just don't know enough about this virus yet, but most of the time after you get a virus of this type, you typically have immunity to it. There are case reports of people being reinfected, but some of the data there is uncertain. Would you agree?
Yes, and I think that, I mean, that with the testing being somewhat lacking, I will say that what I think happened in some of those cases where people were reinfected is that they had something else the first time around that was a viral upper respiratory infection of another kind when the testing wasn't widely available. And then the second time around, they actually did have it confirmed by testing. So, so that's the thing, is that if you're using a clinical definition of what constitutes COVID-19 as far as the fever and cough and shortness of breath, sometimes that's not going to be accurate. There are many other viruses that cause those symptoms.
So this question is, why are people dying of this? So one of the things that happen to people when they get a respiratory virus is they can go into a condition we call ARDS, which is acute respiratory distress syndrome. It's the virus overwhelms the lungs and causes an inflammatory response. And ultimately, the lungs are not effective and the person can't import oxygen into their system. The treatment for ARDS is supportive. We use artificial breathing machines. We use artificial nutrition, and basically we support a person's body while they heal themselves. There's really no specific treatment for ARDS. It's mostly supporting the person while the patient heals themselves. Next question is if carriers are asymptomatic, what good is screening visitors? Would you like to take that?
Sure. So, I mean, this is a problem, and this is why we are telling people in general to stay at home right now. The fact is, we're taking people's temperatures when they come into the hospital, but I mean, the data from China shows that about half the time people don't have a fever. Obviously, taking people's temperature is going to catch people with fever, but not people who do not have fever. This gets at a larger issue, which is that there is what's called a latency phase, but it's basically the period of time between when you're infectious and when you develop symptoms. It seems for COVID-19 that the latency phase is about 4 to 5 days. That does mean that you can be asymptomatic and spreading it to other people. This is why we are recommending to stay home.
Why are doctors still requiring office visits to prescribe medications?
That sounds like an excellent opportunity for telehealth, honestly.
Yeah, I think that we are trying to address that through telemedicine. And one of the things that I was asked to remind people is you can download the Zoom app, which is we're using Zoom as a platform to conduct telemedicine visits in our system. And it is a lot easier if you have that downloaded ahead of time. Is there a difference in the symptoms for children versus adults? Quickness in onset to critical situation.
So actually, it does not seem that kids are getting this for the most part, which is very fortunate, but it's not to say they can't get it, it's just that they are not getting it. So I would say that For adults, however, it does seem that people get more sick the older they are and the more medical problems that they have. So about 80% of people who get this will have a mild to moderate course. Moderate meaning they might cough for a long time, but generally they don't need to be hospitalized. About 20% of people who get COVID-19 will require hospitalization, but about half of those will need the ICU. So something very important to know about COVID-19 is that when it starts to get bad, it decompensates very quickly, so it gets worse very faster than other viruses and develops into what Dr. Betts was calling ARDS, basically. So it is important if you start developing severe shortness of breath and you can't catch your breath, that you go into the ER. And with our testing taking so long to turn around, we're having to tell people this generally until the results are available. This is how this is different from other viral upper respiratory infections, because most other viral upper respiratory infections do not cause that severe of illness quickly.
Are there cases in Staten? Yes, there are. What are your contingency plans if you reach capacity? Do you have reserve staff for employee absences due to exposure? We have made some contingency plans. It is impossible to plan for every possible eventuality. We have reserve teams. I think that, frankly, nursing will be the greatest limiting factor. I think we have more ventilators than we've ever used before. I have physician backup teams, but I think that for this facility, I think nursing will probably be the tightest limiting factor.
And we are really working right now to kind of repurpose people who are not busy in other areas. So so right now we're working we have a lot of doctors who are volunteering to kind of expand their skill set and to move into areas that normally they wouldn't do, but in order to expand the capacity of the hospital and clinic systems. And so we are taking a lot of people who would normally be working in, say, the surgery clinics, and kind of taking the opportunity to repurpose them towards telehealth or towards the helpline or towards the respiratory clinic. And it's been very inspiring to see how many people are volunteering for that.
Is this going to go away if we just stay at home for the next few weeks? Is it going to come back next year? So it's impossible to say with certainty. I don't think that this is going to just go away if we all stay compliant with our social distancing. What it will do is it will decrease the peak of activity to a point that the hospitals will be able to manage it. Unfortunately, I think it'll be around for some time. I think that after the peak is passed, we will start re-entering normal life piece by piece, hoping that it doesn't flare up too hot and too fast. I'm not sure whether there's any seasonal variation. There was a lot of conjecture about that, but it seems like this doesn't have much of a seasonal component. The next question is, should we be sanitizing food items and food items that are delivered? I think that cooked food is probably pretty safe. I think food that isn't cooked, there's some intangible amount of risk that's associated with that. I think that before you eat, it's a reasonable and safe thing to do to wash your hands. I think that food stored in a refrigerator is a desiccating environment, and I think that's probably adds a level of safety. Do you have anything else on that?
Well, just that I wanted to point out that soap and water does kill the virus. So I know there's some concern about hand sanitizer being in short supply, but although we have plenty now, and many different groups in the community have been helping out by making hand sanitizer at home. But so soap and water works great to kill the virus, and so you can just sterilize your fruits and vegetables with soap and water at home, and And then heat reliably kills the virus, obviously, so, the virus is inactivated by heat.
Can people be asymptomatic and spread it unknowingly?
Yes.
Can there be false negatives?
I don't think the testing is widely available enough, but the sensitivity and specificity of the tests that we have so far are very good. And that is to say that we haven't had a lot of experience with false negatives so far. It's theoretically possible, and I think as this progresses, we are going to find out exactly how much of an issue that is. But so far, the testing is very good.
We probably need to experience thousands and thousands of tests to really know how frequent false negatives are problematic, I'm guessing.
Yeah.
Can you speak about herd immunity? Do you think that we will have a treatment or cure by the time we get to that point? That is a fantastic question. Dr. Van Sant, what percentage of the population do you think for herd immunity to develop? 50%, 70%?
So herd immunity is the idea that once you get most people, there's not a hard and fast percentage, but once most people have immunity, either by vaccination, which we do not have yet, or by having had the virus, then there is a protective effect to the whole community. That is what we are shooting for when we vaccinate people, is to basically create the herd immunity. And a vaccination is basically like it's producing the effects of an infection without actually getting the infection. So it activates your immune system in a way similar to that of having the infection. So the vaccination would be great, but we're probably a year and a half away from that coming out. In the meantime, I think actually people getting this is probably going to be what produces the herd immunity faster than us producing a vaccine. And as Dr. Betts said, the goal is just really to flatten the curve, but basically to spread out the process of people getting it in a way that doesn't overwhelm healthcare facilities.
What type of PPE are you experiencing the most shortages of? And the question says masks, face masks, face shields, gowns, or gloves. So earlier in the month, gowns were very tight. Currently, masks are pretty tight. Gloves, we have a pretty healthy supply of. Face shields have been very tight, and people have been using goggles. There is a number of people that are producing 3D printed face shields, and we're anxiously awaiting those to arrive.
Oh, we have some. Our respiratory clinic, which probably should have told you that before now, but so we 3D printed some of the head piece, like the headband, and then the plastic piece was applied to that. It's pretty cool, and it works great. We were using them today.
Well, I'm anxiously awaiting them then. If a person were to come in to get tested, how long does it take to get results?
So by the end of last week, it was taking a couple days, and now I think the estimate is about 3 to 4 days. Hopefully we will start testing on site soon, but until that happens, we're reliant on LabCorp and Quest, the private testing facilities, and that is really taking 2 to 4 days, really.
How long has your team been training with the current pandemic plan? I came back from Omaha, Nebraska mid-February and started talking to people shortly thereafter. Luckily, the hospital leadership was able to hear what I had to say and thought that it was a big enough concern to start a group. So we've been working on it regularly since mid-February. If I think I have regular bronchitis and no fever, do I wait until I have trouble breathing to go to the hospital?
No. You can be seen before then, and I think if, it's, in general,
Go to your doctor.
It's kind of a spectrum, I think that you can, that's why we're developing these other ways of seeing patients without having to bring them in. So you can call someone and sort of bounce your symptoms off, like talk to them about your symptoms. Or you can use our telehealth, which it will allow the doctor to kind of see you, and see how severe your symptoms are that way. But don't wait until you're severely ill. I think we are trying to get the respiratory clinic up specifically to take patients who may have COVID-19 and need to be seen, and also so that we can have the primary care clinics function separately from that and safely without spreading COVID-19.
Is it safe to take ibuprofen while you're infected?
Yes.
This question says, is it possible that the virus was around before we even knew about it and it didn't originate where they think it originated? Some hearing a lot about people with strange illnesses that were pretty severe and it just disappeared. I think it's fairly safe to say that this virus is emerging and that it's clear that nobody has prior experience or immunity to this virus. That's why it's spreading so rapidly and so severely. I think that emerging diseases are an ancient phenomenon, and unfortunately they're becoming more common. It has more to do with the globalization, rapid travel, and encroachment on wild areas. This virus very clearly started in Wuhan province and likely has a reservoir in bats. It's like several other similar viruses, and there's really no question in my mind that that is the case.
So someone is asking here what our opinion of the prediction of at least 100,000 COVID-19 deaths in the U.S. And this brings up a point that I think is really, really important. How long this lasts and how bad it gets depends on what we do right now. We have the power to stop this, and we just need people to stay at home and take these measures seriously. I mean, each and every one of us has the ability to help in this situation by social distancing, and we all need to be doing our part to help prevent the spread of COVID-19.
If somebody is diagnosed with COVID-19 and they're currently in home quarantine, at what point should they be hospitalized? When they become short of breath is probably the easiest answer, though there are many other reasons why somebody might be hospitalized. It's a difficult question to answer, to give somebody a concise time and reason to go to the hospital. But I think if you're short of breath, that is clearly one of them. Probably if you're unable to take food, that would be another. I think, unfortunately, some things are hard to be super concise about. Can you share with us some of the de-stress options for those who need it? I have many. I have known many. Oh, sorry, here, let me just reread this again. Can you share with some de-stress options for those who need it? I think going for a walk and exercise are probably the best de-stress options, certainly for me. Working in a garden seems to be like a very good thing to do these days. Going for a walk outside is safe, and good exercise is pivotal.
Well, and talking to other people about, talking to friends and family is an important thing to do at this time. And just sharing your fears with other people. Sometimes just talking about it does make it better. I know this weekend my family actually all met up over Zoom and talked for about an hour and a half on Saturday. And my niece is actually the best one. She's the best one at using Zoom. But I would encourage people to do that. You can use that platform to meet up with people you care about to check in on them. And sometimes actually seeing people makes you reassured that they're not just making themselves sound okay, that they actually are okay. So I would encourage people to call people or use social media to check in with those you care about and just talk through some of your fears.
This question says, earlier this evening, the news reflected testing from Abbott, which would enable quicker results and would be, appears to be compatible with typical lab equipment. We don't support that platform at this hospital. We support different platforms, which would provide a similar capability. We hope to have on-site testing in the next week or two, depending on when we receive that equipment. Dr. Van Sant, would you like to comment on the vitamins or minerals or herbs that might be helpful?
He's kind of making fun of me because I do support the use of vitamin C. I don't think there's any adverse health effects associated with it, and I think it might help and it doesn't hurt. So yeah, take your vitamin C. I mean, you'll be fine. It might help, it won't hurt. You'll just pee out any extra. You can't overdose on vitamin C. That's my story and I'm sticking to it.
Okay. I say eat an orange. Is there any more update on pregnancy and COVID-19? There have been documented cases of pregnant women having COVID-19. Thus, the infants born to women with COVID-19 do have antibodies circulating, which tells you that the antibodies cross the placenta. There is one case that was reported in the media about a neonate dying with COVID infection, though it's unclear whether the death was related to the COVID infection or that was an incidental finding. It is noteworthy that this virus seems to spare children to a large degree. Is anemia on the list of underlying conditions that would put somebody at risk for COVID? I don't believe so.
So the underlying conditions that we worry about generally are things like emphysema, also known as COPD, asthma, diabetes, obviously cancer, anyone who's on immunosuppression of any kind. That includes chemo and steroids. Those are the people that we worry about with this. Really, the way that your body fights off a viral infection is via your immune system. So people who are immunosuppressed are going to have more issues than those who are not.
What are the requirements, Dr. Van Sant, for someone to be considered recovered from this virus?
So the CDC is saying that about 14 days from when you develop symptoms, you should be considered recovered. Studies are going on right now to determine what are the outliers in terms of how long a person can shed virus. But I mean, we don't exactly know the numbers on that. 14 days after the development of symptoms is what is currently being considered safe. I would also say that I mean, the point at which, even with normal viral upper respiratory infections, I mean, people shouldn't be going back to work until they are feeling better for about 2 to 3 days. And I would say that clinically it's based on whether or not you're coughing. So if you're coughing uncontrollably around other people, that is the thing that is aerosolizing the virus all over the place and infecting other people. But short answer, 14 days after you develop symptoms.
Next question, has anyone looked into a study relating COVID to swine flu vaccine back in the day? I'm unaware of any connection. Because there's very different viruses, I can't imagine that there would be any connection between the two. Next one is, what about lupus as an underlying condition?
I mean, lupus is an autoimmune condition, and most of the medications that are given for lupus suppress your immune system. So if you are on treatment for lupus, you would be immunosuppressed. That is a person at higher risk.
I know turnaround times have been an issue. How close are we to developing a PCR test so these cases can be identified earlier? So the testing that is being used is a PCR test. It's just a matter of having the capability to run that test. The testing platforms are very specific and need to be verified to make sure that they're accurate, and that's one of the limiting factors. The equipment that we have we will be using a different platform that has a validated testing. It's like a pre-made cartridge, and once those are on site, then we will be able to turn around tests in a couple of hours. Hopefully we'll have an increase in testing capacity in the next few weeks. I want to thank all the local doctors and nurses, healthcare workers. You guys are working so hard, and it's very appreciated. Thank you. That is very sweet. It has been really uplifting to have such support from our community and to hear those positive voices. How are you doing as medical personnel being on the front lines? Is there anything that we can do to help you guys besides staying home?
I mean, mainly just take care of yourselves and each other. And I mean, you know, I would think checking on your neighbors would be a really good idea. But I mean, we're here for you, and we're not going anywhere. So if you need help, please seek us out.
Can you tell us about making masks? Are you taking homemade masks? Yes, we are taking homemade masks. There's been a little bit of debate initially about how to utilize them, but I think we have a plan for their use. We are taking them, and we also have sewing kits available.
We're issuing sewing kits.
Which have patterns.
Right.
And they have been useful, so I thank everybody who has made them. When should we start to see a decline in cases if we follow the quarantine guidelines? I hope that the University of Washington modeling is correct, which would put the peak of cases in Oregon around the first week of May, which would mean that at least the rate of cases would slow down after that. Have precautions changed from droplet to airborne transmissible yet?
No, they haven't, and this is a really important point. All of the coronavirus viruses are droplet, and the difference between droplet and airborne is that airborne are smaller particles that travel further, and we have to put people in negative pressure isolation when they come in. Examples of this are tuberculosis, and the way that we treat that is different than for droplet-borne diseases. So droplet-borne diseases are basically clumped up into larger droplets. So they tend to be larger, they don't travel as far, and when they land on surfaces, they contaminate the surfaces. So that is why we are able to care for those patients in rooms that are not negative pressure isolation, and why surgical masks are effective against it, because they catch the droplets when you cough, as opposed to with airborne diseases. Airborne technically means that you should have an N95 mask, but regular surgical masks work to catch the droplets as you're coughing for COVID.
And it also is to stress the importance of contact infection. So that's why the hand sanitizer becomes so critical, and just wiping down surfaces, because the droplets get spread around through coughing and contaminate surfaces. So luckily this virus is relatively easy to kill with most household disinfectants. soap and water. So it's, I feel like the contact component of this is generally underplayed, and the respiratory component is focused on. We heard that there are cases at the Marion home. There have been cases at the Marion home, and I just wanted to take this opportunity to say that the people, we have been in contact with the staff at the Marion home, and they're working extremely hard to care for their residents. I don't think that the presence of this virus at the Marion home reflects poorly upon the staff there. I think that they have a population of very vulnerable residents. I think that this virus will eventually and unfortunately affect every nursing home or concentration of older people or people with pre-existing conditions. We have reached out to the Marion home and have offered to help in any way we can. To date, I am unaware of anybody seriously ill there. The next question is, sorry, I just moved here. I'm hearing that the 2 antibiotics show promise. What information do you have regarding this?
So just to be clear, antibiotics generally do not work on viruses. Antibiotics are active against bacteria. So there have also been some proposals of using antivirals, but they did not work. So the virus, there's a lack of data for most of this, but the antivirals that have previously been used against HIV, they did do a randomized control trial of that, and it showed that it doesn't work against COVID. There is no pharmaceutical treatment of COVID yet, and I mean, it may take a really long time to develop anything like that. If you think about it, really, most viral upper respiratory infections do not have a treatment. Flu is an exception to that. We do have a treatment for influenza, but most of the viral upper respiratory infections do not have treatments. So there is no treatment that is evidence-based at this time.
Can this virus be transmitted through other things besides droplets? Can it be transmitted through the blood, urine, or through the feces?
So it is not spread by the GI tract. It's a respiratory virus, so it does not appear to be transmitted by the GI tract. It's present in the blood, so we have not yet documented any cases of it being transmitted by blood. But I think that at some point we probably will need to address screening the blood supply. I think that it seems possible anyway, but that is not really something that has been documented so far. Generally, this is spread like other respiratory viral infections by coughing, by droplets.
If a person has underlying conditions, are they safe to go shopping if they take necessary precautions?
You have to do what you have to do. I think if you, so that's why we want to facilitate people who are sick staying home, and either identify people in your community who are not sick who can help bring your groceries and leave them on your front porch or front stoop, or ask for help from the hospital, and we can see if we can deliver your groceries for you. If you are asymptomatic, though, it is okay to go to the grocery store. You just have to obey social distancing while you're there and try to keep 6 feet between you and other people.
I thought treatment for malaria was found effective.
So that's the chloroquine, and it has not been proven in the data yet. The studies just aren't there yet.
I would agree. Do we plan on repeating this format? I think that if the community feels that this is useful, I could envision doing this again from time to time. Unfortunately, there's an awful lot of work to be done, so this does take some time to set up and to do. I think that it's important that the community have a forum to ask questions directly and so they can hear things without having an intermediary step. We are not movie stars or newscasters, and it probably shows, but I think that the community should be able to ask questions directly. Would a pneumonia vaccine assist in virus prevention? Dr.
So pneumonia vaccines are very good for you if you need them, but it's not active against this virus.
But it might prevent the subsequent.
That's true.
It might prevent the subsequent.
So it can prevent a secondary bacterial infection, which is of a concern. Can happen after a viral upper respiratory infection. So get your pneumonia vaccines if it is indicated for you.
If a droplet lands on a mask you're wearing, won't the virus come through a homemade cloth mask?
So the cloth masks should be catching virus, but it's true that when you're breathing on it, it's not considered a clean surface per se. I would say that the advantage of the cloth masks is that you can potentially wash them. And soap and water do work against the virus. So I think you shouldn't be sharing cloth masks between people. Obviously, that kind of defeats the purpose. But it is fine to use a cloth mask, and the effect of that is really to catch the virus like you would with your elbow when you're coughing. It catches the droplets before they can be aerosolized.
I think it would be safe to say it catches the droplets, and then the droplets would then be absorbed into the mask, and the virus would stay in the fabric.
Yeah,
it's not the same as an N95 mask. It doesn't have that level of filtration. It's not as effective as a medical grade mask, but it does probably help in the sense that it controls droplets. I view them as a part of the pandemic social etiquette that we have, where if it's a nicety to be surrounded by people that are wearing masks, because if you know that if somebody were to start coughing, some of that would be captured by the mask. What does the public?
I think it's how.
How does the public
How
get
does the
information
public,
about
yeah.
volunteering to help assist with the disabled or elderly?
Thank you.
I would think if it's through our program, you would email the SIT mobile at santiamhospital.org for more information if you're interested in volunteering to help assist in that process.
Capital S, capital I, capital T, and that's what they're trying to do right now, is to help
They are.
with those vulnerable people.
And they're taking volunteers.
Yeah.
What part can CPAP machines play in the helping people who get the virus? I hear that there's a shortage of respirators. This could be an option. So in the hospital, CPAPs have a limited role because of some technical components of infection control. We plan to use them as a bridge and to get people to ventilators. Whether there's any role for a person who uses the CPAP at home, I would say controlling your pre-existing sleep apnea would be optimal if you had developed COVID, and you should probably use it as prescribed. I can't imagine any reason why you wouldn't use your prescribed CPAP. So if this is a SARS outbreak that has combined and mutated with a very transmissible flu and created some kind of parvovirus. So this is a novel coronavirus, which is related to the SARS virus of 2002. It doesn't have anything to do with influenza except the fact that they seem to be circulating at the same time, which may or may not have something to do with the nature of the pandemic. I don't think that they're combined in any way. I think the power of this virus is the fact that it's new to humanity and we have no immunity against it. Who in the area can we call in case of cleanup to exposure? That's an interesting question. I don't really know. I think if,
As it relates to COVID-19?
Yeah.
Is that the question?
Well, so, I mean, remember, again, soap and water are effective against the virus. So you can and should be cleaning up the surfaces around you. I mean, the most prime example is your hands. Just wash your hands on a regular basis. Pretty much if you're thinking about it, go ahead and do it. Soap and water should be used for about 20 seconds, or the time it takes to sing happy birthday to yourself twice through. And I mean, you don't need special materials to clean up after this virus. I mean, it's, so if that's what's being implied here, that's not true for this virus. Soap and water is adequate to kill the virus.
soap and water, bleach, alcohol, sunlight, all very good at killing this virus. So it's been an hour, and we have 300 plus questions, and unfortunately we're out of time for tonight. But I think this has been fairly successful, and I would hope to do it again. I would like to thank everybody who made this possible. I think that the support from the community has been fantastic, and we're all deeply appreciative of that. I want everybody to know that the people here at Santiam Hospital have been working diligently every day to try to prepare for any contingency. We again thank you for your support. Maggie, do you want to take us out?
No, yeah, I do, and so on behalf of Santiam Hospital, we really appreciate both Dr. Betts and Dr. Van Sant, all of our staff who are working in the front lines. We are here for you. We hope you enjoyed this type of a format. We'd love to get your feedback. We are here, and I think the message that we want to deliver is to stay safe and to stay home. If you have a problem, we will be here for you. So thank you for tuning in.
Okay, we're clear.
Oof.
Awesome.
Yay.
You guys did great.
First one.
Nicely
Good job.
done.
Yeah.
Good job.
Daughter's